Do you want to know how to tackle bargaining patients in your clinic? Let's discuss that today. Hi guys, welcome to LDFS. I'm Dr. Lakshmy. Today we'll be discussing about how to tackle bargaining patients. Now, if you have not seen my earlier video where we have discussed why do patients bargain, the link is there in the description below. You can check that out. In today's video, we will be discussing the 5 different steps of how to tackle a bargaining patient. Now, these steps are, I tried and tested methods, which I did for my clinic, and I was able to reduce around 70 to 80% of bargaining patients in my clinic just by implementing these 5 steps. Let's discuss these 5 steps today. First is find the decision maker. Now, whenever some patient comes to your clinic, you need to understand, is he or she the decision maker of his family, or is there someone else? Is there someone accompanying him outside? So there's many times this has happened that, housewife is your patient and the husband will be standing outside and he will be the decision maker of the family. And sometimes it's like the parents are your patients, but the decision makers are their son or daughters. So you need to understand who are the decision makers and are they present in the clinic at that time. And if possible, it's always better to have a direct chat with the decision makers. Involve them in the treatment discussion, because if you are able to convince the decision makers, then half of your job is done. So wherever possible, first thing is to have a direct chat with the decision makers and clear all their doubts which are there in their mind. Second step is use layman terms. Now, many dentists feel that when they are using the technical terms, the patient will feel that they know a lot about the subject. But I always feel it's the other way around. If you are able to explain everything to the patient in layman terms, that is what treatment is required, why is it required, how it will be done, then to convince that patient is very easy. And sometimes it has happened that your consultation is going on and suddenly their friend or somebody enters your clinic, and the friend or the relative has some doubt about the treatment, and your patients will be the advocates for you. They will explain it to them, why is it required, how it will be done. So that's the best state to be in, because the patient knows in and out why is it required. So the bargaining and everything comes when they are not, or rather they are unaware about the oral health issues. They are unaware about the value of it. So that is tackled when you're explaining nicely to them and in layman terms so that they understand it thoroughly. So that is the second thing to do. Now the third thing to do, show them the larger picture. Rather than telling them the benefits, tell them what will they lose if they don't do the treatment right now. For example, if they are complaining of missing tooth, then if it is not replaced, there will be drifting, there will be supraeruption, and there will be problem in chewing and all those things. So you can inform them about those things so that if the treatment is not done, then these are the problems which you will face in the future. If they came to you for root canal treatment and they want to postpone the treatment for xyz reason, then it's always better to inform them that it is quite possible that whenever this next symptom or the pain occurs, then this tooth will be in a condition where we won't be able to save it, and then we have to remove the tooth and replace the tooth and all those things. So it's always better and to make them understand and give them the larger picture. Tell them what they are losing if the treatment is not done today. So that's the third reason. Value of the treatment. That is the fourth point. Now you need to make them understand that how are you adding value by doing this treatment. So that can be by, informing them about the benefits, informing them the different type of caps, and why are you saying that they should go ahead with the zirconia cap? What value are you adding? What are the reasons why you feel that that should be the zirconia cap should be the one they choose? Or maybe if you are, trying to convince them for implant, then you should make them understand what are the values, what are the benefits if they go ahead with the implants, the different type of, from their point of view, not from our point of view, but from their point of view, what benefits they are getting. Like the, if they do implants in place of a fixed partial denture, then the other teeth are totally in the, way it is. You are not reducing anything, you are not giving any extra cap or any other procedure, you are just dealing with that single missing tooth. So that can be one of the benefit. If you are trying to convince them for root canals, you can tell them how after root canal they can, use their teeth for quite a long time, and how their chewing will not be hampered. And if you are convincing them for smile treatment, smile designing, then tell them how it can boost their, confidence and all those things. And in this part, when you're explaining this thing, it's better if you show it with the help of an example. Like if you have some pictures of before and after, if you're convincing them for smile designing, if you have before and after picture, then it's great. If you are convincing them for veneers, then to have a model like that, or maybe, some photos of that, it's better. If you can do a mock prep, then that's great. So something like that, you have to be innovative, but you have to convince the patient that whatever they are paying, and the is, worth the value which we are adding. And in fact, the value is much more than the amount they are paying. Ideally, that should be the scenario. If you are able to deliver that, and then there won't be any bargaining in your clinic. So, because this is the main important thing in this. So we have discussed four things till now. First is, find the decision maker. Who is the decision maker? Second is use layman terms. Third is show them the bigger picture. And fourth is add value to the treatment. Now the fifth is not last, it's last, but it's very much important. Price comes at the end. Never discuss price or cost in the first, discussion itself. When you explain all these things, all the four steps are done, then you should proceed to the cost part. I know all the patients are eager to know only the cost part. They don't want to listen to anything else. But if you tell the cost part first, then they won't be interested to listen to all the things which you are saying. They will feel that, okay, it's too costly, we don't want to get the treatment done. So rather than that, convince them first that why do they require and how it will be done and why is it adding value to them, their life. Then you can go ahead with the price, discussing the price part. Now I have tried a few, one thing in this matter, that is, I don't discuss cost. In my clinic, in the consultation room, I'll tell them about all the other steps which, we have discussed. I'll tell them about all those things. I'll discuss all those things, the treatment, and all their queries will be solved. Everything will be solved. The cost part will be discussed outside my consulting room by my receptionist or my assistant dentist. Now, only this is a very small change, but this has helped me reduce 60 to 70% of my bargaining patient. Because when we add value to them, we, create a bond with the patient. We create a relationship with the patient. Now, when the patient goes out of the, your consulting room, they remember all those discussion which they had with you, the friendly chat and the reason why it is required and how the all consultation was. And now when they go outside and have a discussion with my receptionist or my staff regarding the cost part, they will be little hesitant or reluctant to come back to the consulting room and discuss the cost with me, because they don't want to ruin their impression. So majority of people, 60 to 70%, they don't want to have, spoil their reputation. They won't come back to you and discuss the cost with you. But still there are 30 to 40% who will be adamant and they want to discuss the cost with you. But at least now you know how to answer them, because we know that we have added value, we have showed them what they will lose if they don't do the treatment right now. All the points we have discussed with them. So it's easy to convince them. It's easy to tell them that, okay, this is the reason. And if they compare you with other dentists also, you can easily tell them that, the quality of product which we are using and the values which we are adding to your treatment, that everything, you can just repeat those things again. So this is the way by which we can handle the bargaining patient. Now, I have applied these 5 things and I was able to reduce around 70 to 80% in my clinic. And this last one thing, the discussion of the cost, which was outside, that was, success for me, because that helped me reduce 60 to 70%. That was a majority of the reduction which, happened with out of these 5 steps. So I would really love to know how you have tackled bargaining patients in your clinic. I hope you like this video. Kindly like, share, and subscribe us. And if you want us to add you to our broadcast list, kindly send us a hi on this number. We'll add you to our WhatsApp broadcast list, where we send our free content, everything first to our WhatsApp customers. And remember to save our number, because if you won't save our number, you won't be able to receive the broadcast messages. Thank you so much, guys. Bye.